Schistosomiasis, also known as bilharzia, is a disease that affects millions worldwide. This parasitic infection is a major public health concern, particularly in developing countries where access to clean water and adequate sanitation is limited. The disease is often overlooked, but its impact on communities can be devastating. It is caused by a parasitic worm called schistosoma. These worms have a complex life cycle that involves both human and snail hosts. The larvae of the worm are released into fresh water by infected snails, where they can penetrate the skin of people who come into contact with the contaminated water. Once inside the human body, the larvae mature into adult worms and reside in the blood vessels, where they can cause significant damage to internal organs. This worm thrives in certain types of freshwater snails. These snails are commonly found in slow-moving or stagnant water bodies such as ponds, lakes, and irrigation ditches. The presence of these snails in water sources used by local communities is a key factor in the spread of schistosomiasis.
While schistosomiasis is not usually fatal in its early stages, it can lead to serious health complications if left untreated. Chronic infection can result in severe damage to the liver, intestines, lungs, and bladder. In children, it can cause growth retardation and cognitive impairment, affecting their ability to learn and thrive. Understanding this disease, how it spreads, and how to prevent it is crucial for public health, especially in areas where access to clean water is limited. Public health initiatives, such as educational campaigns and snail control programs, play a vital role in reducing the incidence of schistosomiasis.
This disease is particularly prevalent in tropical and subtropical regions. These areas provide the ideal environmental conditions for the freshwater snails that host the schistosoma larvae. The warm climate and abundant water sources create a perfect breeding ground for these snails. These regions often lack access to safe drinking water and sanitation. People in these communities frequently rely on natural water sources for their daily needs, which increases their risk of coming into contact with contaminated water. Improving access to clean water and sanitation is essential in the fight against schistosomiasis. The impact of schistosomiasis is often silent, but its effects are far-reaching. The disease can cause chronic illness, leading to decreased productivity and increased healthcare costs. It places a heavy burden on affected individuals and their families, as well as on the healthcare systems of endemic countries, affecting individuals, families, and entire communities. Addressing schistosomiasis requires a comprehensive approach that includes medical treatment, public health education, and improvements in water and sanitation infrastructure. By working together, we can reduce the burden of this silent threat and improve the health and well-being of affected communities. The parasite has a complex life cycle that involves both humans and freshwater snails. This intricate journey begins in the most unsuspecting places, often in rural areas where sanitation is a challenge. It begins when the eggs of the parasite are released into freshwater through the feces or urine of infected individuals. These eggs, invisible to the naked eye, find their way into rivers, lakes, and ponds, contaminating the water sources that many communities rely on. These eggs hatch, releasing larvae called myricidia. The myrichidia are tiny, free-swimming organisms that have a limited time to find a suitable host to continue their life cycle.
These myrichidia then infect specific types of freshwater snails. The snails act as an intermediate host, providing a safe environment for the myrichidia to grow and multiply. Inside the snail, the parasite multiplies, producing another type of larvae called cercariae. This transformation is crucial for the parasite's survival and ability to infect its next host. Cercariae are released from the snail back into the water. These tiny fork-tailed organisms are now equipped to seek out their final host, humans. It is these cercariae that can infect humans. They are capable of penetrating human skin, often unnoticed as people engage in everyday activities.
Contact with contaminated water, whether through swimming, bathing, or even washing clothes, allows the cercariae to penetrate the skin and enter the bloodstream. Once inside, they travel through the body, eventually reaching the liver and other organs, where they mature into adult parasites, continuing the cycle of infection and disease. This complex interaction between humans, snails, and water highlights the importance of proper sanitation and access to clean water in preventing the spread of parasitic diseases. Once inside the human body, the cercariae mature into adult worms. These worms live in the blood vessels where they mate and produce eggs. The initial infection, known as acute schistosomiasis, may cause a rash or itchy skin. Fever, chills, cough, and muscle aches are also common symptoms.
However, many people do not experience noticeable symptoms at this stage. If left untreated, schistosomiasis becomes chronic. The parasite's eggs can become trapped in various organs, including the liver, intestines, and bladder. This can lead to long-term damage, including abdominal pain, blood in the urine or stool, and even liver fibrosis.
Diagnosing schistosomiasis requires laboratory tests to detect the presence of the parasite or its eggs. This parasitic disease caused by blood flukes affects millions of people worldwide, particularly in tropical and subtropical regions. The diagnostic process is crucial for effective treatment and control of the disease. One common method is examining a stool or urine sample under a microscope to look for eggs. The presence of these eggs confirms an active infection. This method, known as the Kato-Katz technique, is widely used in endemic areas due to its simplicity and cost-effectiveness. However, this method is most reliable when infections are heavy and eggs are being shed in large numbers. In cases of light infections, the eggs may not be present in sufficient quantities to be detected, leading to false negatives.
Serological tests, which detect antibodies produced by the body in response to the parasite, can also be used. These tests are particularly useful in identifying individuals with lighter infections or those who have been infected in the past. They work by detecting the immune response rather than the parasite itself. These tests are particularly useful in identifying individuals with lighter infections or those who have been infected in the past. They can provide a more comprehensive picture of the infection status in a population, especially in areas where the disease is being controlled or eliminated. Early diagnosis is crucial to preventing the long-term complications associated with chronic schistosomiasis. Chronic infection can lead to severe health issues such as liver damage, kidney failure, and bladder cancer. By identifying and treating infections early, we can reduce the burden of this disease and improve the quality of life for those affected. Public health initiatives and education are also essential in raising awareness and promoting preventive measures.
The good news is that schistosomiasis is treatable.
The mainstay of treatment is a medication called praziquantel. Praziquantel is highly effective in killing the adult worms, thus interrupting the parasite's life cycle.
It is typically administered in a single dose and is safe for most people, including children.
The World Health Organization, or WHO, recommends praziquantel for both the treatment and prevention of schistosomiasis.
In some cases, additional treatments such as surgery may be necessary to address complications caused by chronic infection. Preventing schistosomiasis requires a multi-pronged approach that targets different stages of the parasite's life cycle.
One crucial step is reducing human contact with contaminated water. This can be achieved by providing access to safe water sources for drinking, washing, and bathing.
Improving sanitation is equally important. Properly constructed and maintained toilets prevent the contamination of freshwater sources with infected feces and urine.
Additionally, snail control measures, such as using milicides to kill the snails that harbour the parasite, can be implemented in high-risk areas.
Schistosomiasis is considered a neglected tropical disease affecting primarily poor and marginalized communities.
Recognizing the global burden of this disease, the WHO has developed strategies to control and eventually eliminate schistosomiasis.
Mass drug administration programs where praziquantel is distributed to entire communities have been highly effective in reducing the prevalence of the disease.
These programs are often combined with education campaigns to raise awareness about schistosomiasis, its transmission and prevention methods.
Collaboration between governments, international organizations, and local communities is essential for the successful implementation of these public health interventions. The fight against schistosomiasis is ongoing, and researchers are continually working to develop new tools and strategies to combat this disease.
One promising area of research is the development of a vaccine against schistosomiasis. A vaccine would provide long-term protection against infection, particularly in high-risk areas.
New diagnostic tools are also being explored to improve the detection of schistosomiasis, especially in its early stages.
These advances, combined with ongoing efforts to improve water, sanitation and hygiene conditions, offer hope for a future free from the burden of schistosomiasis.
Schistosomiasis is a preventable and treatable disease.
Early diagnosis and treatment are essential to prevent the debilitating long-term consequences of chronic infection.
By raising awareness about schistosomiasis, supporting public health initiatives, and investing in research, we can make a difference in the lives of millions affected by this neglected tropical disease.
Working together, we can turn the tide against schistosomiasis and create a healthier and brighter future for all.
Remember, access to clean water and sanitation is not a privilege, but a fundamental human right.
Let us strive to make this right a reality for everyone, everywhere.